What strain is Indonesia dealing with, and what are the experts saying as to why children are so susceptible?
Yeah, currently we don't have the answer right now, but I think one of the thing that we can say is that this Delta variant is much more spreading easily, as well as the health protocols that we need to really obey. It's not being clearly done by committees, and this is impacted to children especially. Uh, and of course, now where health facilities is difficult and overwhelmed right now. For example, one of the hospital um, is requesting us to support tents just to give that extra space to in the hospitals. This is now is everywhere in Indonesia. The bed occupancy rate is up to 90% right now, and this is really worrying. Accessing health facilities is now is difficult, um, not only for COVID but for everyone, especially for children. And as you know, I mean, Indonesia is much diverse country, very large, and children is very vulnerable right now, especially with poor families, disabled children, where access is really difficult right now.
We have been seeing some heartbreaking reports about people dying in hospitals because of a lack of oxygen supplies, and it seems like that is a problem that's only increasing in the country, which is very difficult for everyone there, of course. How is the government handling the virus there? Are residents being subjected to any sort of lockdown or tough rules at the moment to try and stop the spread?
Yeah, I think, well, now the government is taking a stricter restriction to mobility. So now Jakarta and also in Java Island, it increased stricter restriction in for people mobility, and also working now has been work from home. But this needs also to expand to other areas in Indonesia, because the virus is already in other areas and remote areas, especially where we work. Also, we have cases as well. It's also difficult to access vaccine, and vaccine is not. I mean, in bigger cities such as Jakarta or other cities, it's easy, but in remote areas where we work, it's still difficult to access vaccine, and also for children as well.